हेलो एवरीवन, न्यू चैप्टर शुरू करते हैं. रेस्पिरेटरी पेपर 1. इसका फर्स्ट क्वेश्चन है मैक्सिमल ब्रीदिंग कैपेसिटी इज़ ए 6 लीटर, बी 500 ml, सी 75 लीटर एंड डी 125 लीटर. राइट ऑप्शन इज ए 6 लीटर. नेक्स्ट क्वेश्चन इज सर्फेक्टेंट ऑल आर ट्रू एक्सेप्ट ए surface tension lowering agent, B increase the compliance of lung, B absence causes emphysema, and D chemically dipalmitoyl and phosphatidylcholine. Right option is C, absence causes emphysema. Next question is ratio of anatomical to physiological dead space is in a healthy individual is A 0.8, B 1, C 1.2 and D 2. Right option is B 1. Next question is maximum air flow resistance is offered by A trachea, B terminal bronchiole, C medium sized bronchi and D large bronchi. Right option is A trachea. Next question is when blood is equilibrated with 100% O2 and Hb become 100% saturated, then each gram of normal Hb content A 1.34 ml, B 1.39 ml, C 19.8 ml and D 20.1 ml. Right option is B 1.39 ml. Next question is O2 dissociation curve shift to right in all except A temperature increase, B CO2 increase, C pH decrease and D HbF increase. Right option is D HbF increase. Next question is hematocrit value of venous blood is dash to arterial blood. A less, B more, C equal and D no relation. Right option is B. So right answer is hematocrit value of venous blood is more to arterial blood. Next question is Haldane effect is A moving in of Cl for every HO3 moving out of RBC, B oxygen dissociation curve, C deoxygenated blood carry increase CO2, C myoglobin has greater affinity for CO2 than Hb. So right option is deoxygenated blood carry increase CO2. Next question is carbon monoxide poisoning causes which type of hypoxia? A hypoxic, B anemic, C stagnant and D histotoxic. Right option is B anemic. Next question is cyanosis and bluish discoloration of the skin and mucous membrane depend upon A relative proportion of reduced and deoxygenated Hb, B absolute amount of reduced Hb, C thickness of the skin and D fragility of the capillary. Right option is B absolute amount of reduced Hb. Next question is having Brewer reflex is very important for A kinetic stroke breathing, B deep breathing, C cavernous breathing and D tidal respiration. Right option is B deep breathing. Next question is carotid body is situated at A root of external carotid artery, B beginning of internal carotid artery, C in medulla and D in pons. So right option is A root of external carotid artery. Next question is in patient with lobar pneumonia due to pneumococcus identify the correct order to which the following pathological states appear. A red hepatization, gray hepatization, congestion and resolution. B congestion, red hepatization, gray hepatization, resolution. C congestion, gray hepatization, red hepatization, resolution. D gray hepatization, then red hepatization, congestion and resolution. So right option is B congestion, then red hepatization, gray hepatization and resolution. Next question is match character of septum with diagnostic value and select the correct answer using the quotes given below the list. One side septum, one side diagnosis. So green and yellow septum sputum site. A. Green and yellow sputum. B. Rusty sputum. C. Copious, purulent and offensive sputum. D. Pink and frothy sputum. Diagnosis: bronchiectasis, LVF, bacterial infection and pneumonia. So, which one is correct? So the right option is A, A3, B4, C1 and D2. So green and yellow sputum diagnosed with bacterial infection. Rusty sputum diagnosis as pneumonia. Copious, purulent, offensive sputum diagnosed as bronchiectasis. Pink and frothy sputum diagnosed as LVF. Next question is, red currently jelly sputum is seen in A. Mycoplasma pneumonia, B. bronchiectasis, C. Klebsiella pneumonia and D. amoeboid lung ulcer. Right option is C. Klebsiella pneumonia. Next question is, alpha 1 antitrypsin deficiency causes dash emphysema. A. Centri acinar, B. pan-acinar, C. distal acinar and D. irregular. The right option is B. So the answer is alpha 1 antitrypsin deficiency causes pan-acinar emphysema. Next question is, best view to demonstrate right pleural effusion in chest X-ray is A. right lateral decubitus, B. left lateral decubitus, C. supine and D. prone. The right option is right lateral decubitus. Commonest causes of spontaneous pneumothorax is A. TB, B. trauma, C. rupture of subpleural belt and D. asthma. The right option is B. trauma. Next question is, commonest carcinoma of lung in non-smoker. A. squamous cell carcinoma, B. adenocarcinoma, C. small cell carcinoma and D. large cell carcinoma. The right option is D. Right option is B. adenocarcinoma. Next question is, Monday chest tightness is feature of A. asbestosis, B. silicosis, C. bacinosis and D. Berlinosis. The right option is C. bacinosis. Next question is, in hemoptysis, blood usually come from A. bronchial vein, B. bronchial artery, C. pulmonary vein and D. pulmonary artery. Right option is B. pulmonary artery. Next question is, following are the feature of asthma except Hirschman's spiral, B. Crayola body, C. hinge body and D. Lennox pearl. The right option is C. hinge body. Next question is, hallmark of obstructive lung disease is A. decrease FEV1, B. increase FEV1, C. decrease tidal volume and D. increase tidal volume. The right option is A. decrease FEV1. Next question is, mesothelioma is significantly associated with A. asbestosis, B. berylliosis, C. siderosis and D. silicosis. The right option is A. asbestosis. Next question is, the antigen source of farmer's lung is A. unharvested paddy field, B. fresh cut hay, B. moldy hay, D. paddy or rice husk. The right option is B. moldy hay. Next question is, FEV1 / FVC ratio less than 80% is characteristic of A. obstructive pulmonary disease, B. restrictive lung disease, C. occupational lung disease and D. pleural effusion. The right option is A. obstructive pulmonary diseases. Next question is, chronic bronchitis is characterized by A. productive cough for at least 2 consecutive month in a year more than 4 successive year, B. productive cough for at least 3 consecutive month in a year more than 2 successive year, C. productive cough for at least 2 consecutive month in a year and more than 3 successive year, D. productive cough for at least 4 consecutive month in a year and more than 2 successive year. The right option is B. productive cough for 3 consecutive month in a year and 2 successive years. The next question is, in chronic bronchitis, red index is A. increase, B. decrease, C. unchanged and D. no relation. The right option is A. increased. Next question is in emphysema. A. PaCO2 decrease. B. And PaO2 decrease and PaCO2 increase. B. PaO2 increase and PaCO2 decrease. C. PaO2 decrease and PaCO2 decrease. D. PaO2 and PaCO2 near normal. The right option is D. PaO2 and PaCO2 near normal. Next question is, all of the following are congenital causes bronchiectasis except A. Cystic fibrosis, B. Hartinger's syndrome, C. Trisomy 21 and D. Hypogammaglobulinemia. The right option is C. Trisomy 21. Next question is, bronchial asthma come under dash hypersensitivity. The right option is options are A type 1, B type 2, C type 3 and D type 4. So right answer is bronchial asthma comes under type 3 hypersensitivity, C. Next question is, all comes under hypersensitivity pneumonia except A. Farmer's lung, B. bird fancier's lung, C. asbestosis and D. bagasosis. So the right answer is asbestosis. Next question is, X cell calcification is a feature of A. silicosis, B. asbestosis, C. bacinosis and D. bagasosis. The right answer is A. silicosis. Next question is, occurrence of tuberculosis is associated with A. asbestosis, B. silicosis, C. bacinosis and D. bagasosis. So the right answer is B. silicosis. Next question is, associated of coal workers pneumocinosis with rheumatoid arthritis is called as A. Retter's syndrome, B. Behcet syndrome, C. Kaplan's syndrome and D. Felty's syndrome. The right answer is C. Kaplan's syndrome. Next question is, farmer's lungs is A. characterized by increased wheezing, B. caused by moldy baggages, C. excluded in absence of precipitating antibodies and D. caused by eosinophilia. The right answer is C. excluded in absence of precipitating antibodies. Next question is, non-cystic ulcer with bilateral hilar lymphadenopathy is seen in A. tuberculosis, B. sarcoidosis, C. silicosis and D. Hodgkin's lymphoma. The right option is B. sarcoidosis. Next question is, pleural effusion with low glucose content is seen in all except A. emphysema, B. RA, C. SLE and D. sarcoidosis. Then the right option is D. sarcoidosis. Next question is, sarcoidosis is characterized by all except A. Hammond's crunch, B. potato nose oats, C. Schulman's body and D. asteroid bodies. The right option is A. Hammond's crunch. The next question is, stony dullness of percussion note is found A. TB, B. consolidation, C. pleural effusion and D. lung abscess. The right option is C. pleural effusion. Next question is, Lambert-Eaton syndrome is associated of myasthenia gravis with dash carcinoma, A. small cell, B. adeno, C. squamous cell and D. large cell. The right answer is Lambert-Eaton syndrome is associated with myasthenia gravis with small cell carcinoma, A. Next question is, shrinking lung syndrome is a feature of A. SLE, B. systemic sclerosis, B. C. polymyositis and D. dermatomyositis. The right option is A. SLE. Next question is, cavernous breathing is seen in A. pleural effusion, B. consolidation, C. a lung and D. cavity lung. The right option is D. cavity lung. Next question is, all are feature of ARDS except A. No response to O2, B. Stiff lung, and C. Hypercapnia, D. Right to left shunt. The right option is C. Hypercapnia. Next question is, tubular breathing is found in A. Consolidation of lung, B. Lung abscess, C. Emphysema thoracic, and D. Pneumothorax. The right option is A. Consolidation of lung. Next question is, paradoxical breathing is seen in A. Multiple rib fracture, B. Diaphragmatic palsy, C. Phrenic nerve palsy, and D. All. The right option is B. Diaphragmatic palsy. Next question is, A. Tuberculosis patient could be infectious when he has A. TB meningitis, B. TB lymphadenitis, and C. Pott's disease, and D. pulmonary TB. The right option is D. Pulmonary TB. Next question is, first change in acclimatization at high altitude in increase in 2,3-DPG 2,3-diphosphate glycerate, which occurs within A. 6 to 12 hours, B. 12 to 18 hours, C. 24 to 84 hours, and D. 48 to 72 hours. The right option is C. 24 to 48 hours. Next question is, pulsus paradoxus are seen in A. aortic stenosis, B. asthma, C. bronchitis, and D. mitral stenosis. Right option is B. asthma. Next question is, all the following can be measured by simple spirometry except A. inspiratory reserve volume, B. expiratory reserve volume, and D. residual volume, D. tidal volume. The right option is C. residual volume. Thank you. Please like, share, and subscribe.